Hey there VCE HHD students, my name is Andy, I'm a VCE Health and Human Development teacher. In this short video we're going to look at the principles of the social model of health in VCE HHD. Before we dive into this video, just a reminder there's a range of different ways you can engage with the Health Resources Hub. We've got our YouTube channel, there's over 150 content videos, SAC and exam tips, and new videos will be coming out each week during the school term this year. From YouTube you can subscribe with the button in the bottom corner of the video there, or just head to YouTube and search for the Health Resources Hub. We've also got our website, the hrh.net.au, there's opportunities for teachers and students, and if you're a Unit 3 and 4 student and you head there and scroll to the bottom of the page, you'll see there's a registration form for our free student newsletter, which is coming out twice a term this year with free SAC and exam resources. If you head there and sign up, you'll get the first two versions that came out during the first term on the day that you register. Also see our social media links there if you'd like to follow us and get alerts to our new videos and other opportunities, and also our email if you'd like to get in touch. So you can see here we're focusing on the 5 principles of the social model of health. So the social model of health, as you might already know, has a focus on prevention of disease, and it really focuses on particularly lifestyle conditions. So things like lung cancer, cardiovascular disease, obesity, type 2 diabetes, and a lot of these are associated with particular behaviors such as smoking or alcohol intake or a lack of exercise. And so this particular model focuses on changing things within the socio-cultural, environmental, political, and economic environment to encourage people to engage in healthy behaviors. And so often this model includes programs and projects. And so the principles of the social model of health can often be identified and linked to aspects of these programs or projects. And that's typically what you're asked to do when it comes to these principles in a SAC or exam. You'll be given a program or a project as part of the stimulus material. You'll be asked to read that and then identify, perhaps describe, and link a couple of those principles to that particular program or project. So you can see here I've listed the 5 principles, and so you should know those pretty much word perfect. Okay, you need to get them pretty much spot on when you're identifying them in a particular question. And so it can be hard to remember them. So down the bottom there you can see is a relatively common abbreviation that is sometimes used to remember these principles. So IDEA. So each of those letters, okay, in that abbreviation you can see are highlighted in red, okay, throughout those principles there to try to help you remember some of those key terms and then therefore remember that full principle. So we'll go through and talk about what each of these principles means and what you can look out for in a particular project or program when you're trying to link them. So the first one there addresses the broader determinants of health. And so that word determinants, okay, in the current course can be thought of as like factors. So remember we talked about earlier in Unit 3 the environmental and socio-cultural factors. And so when we are talking about these broader determinants, we're talking about broader than biological factors alone. So any program that includes some kind of socio-cultural or environmental factor, okay, is addressing some of these broader determinants that can influence health and well-being. So for example, if it was a program or a project that's trying to set up perhaps groups, okay, that are culturally relevant to a certain group in the community so that they can attend and perhaps learn a new skill, like perhaps a new cooking skill, okay, then that would be an example of this particular principle because it's focusing on socio-cultural factors such as culturally appropriate environments that encourage people to participate in activities like learning a new skill, okay, to improve their health and well-being. The second one there acts to reduce social inequities. So we talked about equity when we talked about the prerequisites earlier in Unit 3. So remember social justice and equity were examples of those prerequisites of the WHO. And so reduce social inequities is focusing on reducing some of those differences in health and well-being between disadvantaged groups and other groups in the community. So if there is a program that's focusing on, say, homeless individuals or low SES individuals or perhaps Indigenous individuals, then that, okay, is acting to reduce social inequity. So trying to improve the health and well-being of these groups, okay, so that they have, okay, better opportunities to live, okay, long and healthy lives. So that's what the second one there is focusing on. The third one empowers individuals and communities, has a real focus on education and skill building so that people can be empowered to take control over their health. So I say to my students that I'd always look out for this one probably first within a program program, because nearly all programs have some kind of educational skill building aspect. So you can talk about the example in the program, what educational skill it's trying to improve, and then how that can help to empower these people to take more control over their health and improve it. The fourth one, acts to enable access to healthcare, is about reducing barriers to healthcare, which might be things like distance and cost. Okay, so by reducing some of those barriers, people are more likely to be able to engage, in activities that promote their health and well-being. And the last one involves intersectoral collaboration. So obviously collaborations like groups working together, to improve health outcomes or health and well-being. So it could be the government working with, say, a non-government organization, and how they might be pooling their funding, or they're putting their expertise together to try to run a program, that's trying to improve the health and well-being of individuals. So this is an example of a common exam question related to the principles. So you can see there this Bush Classrooms project. So it was described in a previous exam, and then the question underneath there was to identify one principle of the social model of health and explain how it's reflected in this particular project. So there's been other questions that have been worth, say, 6 marks, where they've asked you to identify and describe, two principles of social model of health, and then how they're reflected in a program. So you get a mark for identifying, a mark for describing, and then a mark for linking it to the program. Times that twice, and it'll be worth 6 marks then. So this one here is just focusing on one principle and how it's reflected, so it's only worth 2 marks, and then not asking you to describe it, so you don't have to add in that sort of extra description like you might in, say, a 6-mark question. So you can see here, just briefly, this program or project is focusing on Aboriginal men and helping them to break down barriers to access hospitals and healthcare. So you can see there, with that focus on Aboriginal men, you could say that this program is acting to reduce social inequities, because often Aboriginal or Indigenous men have lower levels of health and well-being than other groups in the community, and this program is trying to improve that. You can also see down the bottom here, in the final paragraph, it talks about it's a collaboration between local support services, the Great Southern Aboriginal Health Service, Albany Youth Support Association, etc. So you could talk about involving intersectoral collaboration, because there's multiple groups working together. So often these programs or projects have multiple principles within them, and there are others in here, but just in terms of not making this too long, I'll just leave that there. But make sure you go and have a look, in your resources such as textbooks or practice sacks for some of these different programs and projects, and practice linking the principles to them. A reminder, we've got 2 Unit 3 Area Study 2 SAC preparation sessions coming up soon on April 14th and 28th. That first one's on the last Sunday of the upcoming school holidays, and so they run from 3 till 4:30, and if you register for those on our website or using the link below, you'll get sent a 50-mark practice SAC the same day you register. And so if you complete that before the online session, during the online session I'll be running through an answer guide and letting you know how you can structure your responses to achieve full marks, and also reviewing common mistakes to avoid for this particular SAC, and then there'll be opportunity for question and answer. And following the session, you'll then get sent the answer guide, so you can use that to revise for your upcoming SAC. So feel free to head to our website or the link below to register, and we'll see you there. Thanks so much.